All right, I'm excited to have our next guest on. Dr. Rick Marrs is a dentist and the author of The Big Smile, The Principles of Modern Dentistry for Dentists and Patients. And we're going to talk a little bit about good dental hygiene in this corona crazy time that we're living in. And then also I want to talk a little bit about gum disease and the immune system as well. Please welcome to the bright side, Dr. Rick Marrs. Hey, Dr. Rick.
Hey, Ben. How you doing today?
Good to talk to you. Your voice sounds familiar. I don't know if we talked before. We've been talking to some dentists, a lot of dentists actually, in the last couple of months or so, and there seems to be a kind of thread that runs through underneath what everybody's talking about, and that's the relationship between gum disease, mouth bacteria, oral bacteria, and cardiovascular health. So we'll talk a little bit about Invisalign, and we'll talk a little bit about dental procedures. But can you address that for a little bit and talk about the relationship between dental health and the immune system specifically?
Sure. So, what we're obviously in these times, even as dentists, we realize we are not the first thing on everybody's mind right now is, oh, my God, I'm late for my cleaning. Oh, my God, I forgot to get that filling done, blah, 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 all that stuff, because obviously we have much, much, much bigger things to worry about right now. But what everybody forgets about is, yes, the mouth is extremely important. Lots of times it's neglected. Lots of times, oh, it's just my teeth. And then, you don't realize you have a dental issue till you have a dental issue. And as far as the consequences and the link between the mouth and the rest of the body, for years, dentists have been saying the mouth is the window of the body. Years ago when we all went through the HIV crisis, lots of times we could see the early signs of HIV in the mouth, believe it or not. So the oral manifestations, what we saw there, were indications of, something that was possibly going wrong. But, as far as gum disease is inflammation, basically. And we know that inflammation is not good in our bodies in any way, shape, or form. So inflammation is, when you have inflamed gums and you have plaque build up in your mouth, that same plaque that builds up in your mouth is the same plaque that builds up on your arteries and veins. It's called a C-reactive protein. And that C-reactive protein causes blockages. So it is linked to heart attack, stroke, diabetes, pancreatic cancer, rheumatoid arthritis, early term birth, and this is, believe it or not, this really raises people's eyebrows, even erectile dysfunction. So,
a C-reactive protein?
And when we're blocking arteries and veins and things like that, we're restricting or constricting blood flow. And these are things that can be very, very detrimental. I cannot tell you in my book, I tell a story about my wife had a trainer who came in to see me once, and the trainer was built like an Adonis. I mean, a brick house. This guy was the picture of fitness. He's a trainer, and we diagnosed him with some gum disease, and unfortunately, he didn't follow through with treatment. And about 2 years later, I hear, you won't believe this, guess who had a stroke? And I did believe it, although as shocking as it was, I did believe it because I knew his perio situation. And it doesn't mean that because you have gum disease, you're going to have a stroke, God forbid, but you're putting yourself in a risk category that would be somebody who's a smoker or somebody who's, obese. You're putting yourself in the same risk factors if you're walking around with gum disease. I mean, we see people daily that look great on the outside, that are fit and run and eat good and just don't take care of their mouths. So it's a big issue.
Now, a couple things. First of all, did I hear you say C-reactive protein shows up in the mouth?
Shows up in the mouth and shows up on those, that's what causes the plaque on your arteries and veins too, correct.
So C-reactive protein, that doesn't cause the plaque on your teeth though? Or that's not related to the plaque?
It doesn't cause the plaque on your teeth, but it's in the plaque on your teeth.
It's in the plaque, so there's actually inflammation going on the tooth.
Correct. We do saliva testing in our office. We work with a company that does saliva testing, and we will measure certain bacteria that's built up in your mouth. And certain bacteria has been linked to certain diseases. So we know if you're high in a certain bacteria, like an extreme level, high levels of bacteria, because there's a lot of bacteria in the mouth that's naturally occurring. But if you're high in certain dangerous bacteria, we have to go after that mechanically, sometimes with antibiotics and mouth rinses and things to lower those bacteria levels down, because a lot of that bacteria is removed and will just start growing back, even with amazing, amazing hygiene at home. So that's why sometimes we have to, attack it chemically also with antibiotics and such.
So bacterial species can be diagnostic of certain health challenges, systemic health challenges?
Yes, absolutely.
How fascinating. That's amazing. How about cancer?
You know, we know that gum disease has shown some links to people who have certain cancers, like I mentioned, pancreatic cancer. That's one that's, you know, near, and it's very much a part of my life. I lost my mother to pancreatic cancer, and there is a link between gum disease and certain cancers. I don't know specific situations they might be out there, so I don't want to be misquoted where certain bacteria has been linked to certain cancers. But I think the bottom line at the end of the day is, you know, we're not going to pinpoint. Any patient at home can't pinpoint, oh, my gosh, I want to get this bacteria down in my mouth. But it's just having optimum oral health. I mean, I can't stress it enough. You know, I've done a lot of radio interviews in the last 5 weeks or so, and there's the thing that I'm stressing to people right now is, you know, I talk to people all the time, and people are making certain decisions of, hey, I'm going to start running now, or I'm going to start eating good now. There's no reason why I can't. I mean, the things that we always have excuses for, those excuses are now out the door because time is now our friend and not our enemy. And This is the time. I mean, especially, you know, people that are going to be quarantined for the next few weeks, go out there and brush after every meal, eat as good as you can, and start flossing once a day. I mean, you do something for 3 weeks in a row, and psychologists tell us those 3 weeks, that's how things become habit. Very, very important that we build those good habits.
Do you think that the majority of people do floss and brush and do the proxy brush deal? I'm sure everybody brushes, but flossing and the extra things, do you think the majority of people do that, or the majority of people don't do that?
It's not a question. I know
that the majority
of people don't do it. You know, I can't tell you how many times. I mean, we ask our patients. I can't tell you how many times I wish I had $1 for every time I heard the joke, when was the last time you flossed? And the patient will look up at you and go, you should know because you were there. You know,
okay.
So we know people just, it's one of those things that if people actually did it, you know, there wouldn't be any gum disease, essentially. There'd be much, much, much less gum disease on this planet if people practice good oral hygiene and flossed on a daily basis and brushed at least twice a day, but ideally 3 times a day or more.
So
you can overdo it, too. You don't want to overdo it, but you don't want any food building up between your teeth. I mean, think about something. If you catch food between your teeth and you leave it there, and it stays there over and over and over, that's like, think about bad meat that you'd leave in your car or your garage you forgot about. What would that be like after a day or two, spoiled meat? Well, that's what's going on between your teeth.
Yeah, that's pretty graphic there, Doc. I definitely get a sense of that. But I'm wondering, the teeth seem like they're really not designed like really well, at least for modern diets. There's all these little nooks and crannies in there. Can you really? Well, we got to take a break. We'll come back talking to Dr. Rick Mars. You're listening to The Bright Side. I'm Pharmacist Ben. We'll be back after this. Okay, we're back on The Bright Side talking to Dr. Rick Mars, author of The Big Smile, The Principles of Modern Dentistry for Dentists and Patients. So, Doc, you make it sound really easy. All you got to do is just floss and brush, but it seems to me like the teeth have got all these little nooks and crannies, and there's all these little places where food can hide. It seems almost impossible to really take care of your teeth well. Is that not correct, you think? Or, I mean, what's up? I know a lot of people, including myself, who try as hard as they can to do everything right and still end up with cavities or mouth problems.
Well, usually, you know, we always like to have a reason for everything. You know, it's like somebody breaks a tooth and they come and go, why did that happen? Well, you know, I was just eating mashed potatoes. You know, rarely do you have somebody come in and tell you they broke it on an almond or, you know, biting into something that they shouldn't have been into, but occasionally you do. You know, you can absolutely take good care of your teeth. And there's things you can do early on in terms of, you know, getting sealants in your teeth, and those take care of the biting surface, nooks and crannies. But if you have gaps in between your teeth, you know, you mentioned Invisalign early on, that's a big part of my practice. Close the gaps up. Take care of the gaps, close them up, and if you can't close them up, you know, orthodontically, then sometimes there's ways you have to do it in terms of crowning teeth or changing the shape of teeth or doing the things you do, but get rid of those open contacts. It can be very, very, very dangerous.
Are there always...
You know, I don't want to say there's no excuses. Look, there's always an excuse. You know, and this is extremely harsh, but a good friend of mine many years ago taught me saying, an excuse is a well-planned lie. You know, so if you don't want to take care of your teeth, you won't take care of your teeth. But, you know, we can tell when somebody comes in and really practices great home care. I mean, it shows. When you have, there's no, like, somebody comes in and says, I brush 2 or 3 times a day and I floss every day properly and I eat great and I do the things I have to do. Those people are not going to walk in and, you know, have a disaster going on in their mouths, what we call a schmutz mouth, okay, where it's just full of plaque and buildup and everything like that. They're going to have healthy-looking mouths. And, when you don't, it shows. I mean, there are some people that are genetically, it's like the people that can eat all kinds of garbage and don't put on a pound. I mean, yeah, sometimes genetics comes into play and people get lucky, but that's more the exception than the rule.
Can all gaps be closed?
Can all gaps be closed? I would say for the most part, yes, but there are some few exceptions. But rarely. But for the most part, you can close most of the gaps. I mean, if somebody has like a humongous gap between their two front teeth, more than likely we can even close those, but rarely. Sometimes there's what we call we do something called a bulb analysis, and then we check out the spacing in each arch, how they're divided. And sometimes we can create some space and close some teeth up in one arch and move things around and do what we need to do. But occasionally there's too big a discrepancy, so we're not able to close everything as we need to. So in cases sometimes where the lower teeth are disproportionate to the upper teeth, we sometimes have some difficulty closing every single gap, but that's more the exception than the rule.
What are the worst foods somebody could eat if they have a problem, or if they don't have a problem and they don't want to have a problem? What are like the top 3 or 4 or 5 worst foods for the teeth?
So let's have some fun, okay? Hate to throw it back on you. If you had to guess what's the worst food you could put in your mouth, I'll bet you $1, Ben, you won't guess.
Food or drink? Not including drinks, I would say the worst food is dried fruits.
Okay. All right. Well, you do not win the $1 today, Ben. I'm sorry.
Okay. All right. What's the worst one?
Most people don't. So here you go. Ready? Yeah. But you're very close.
Yeah.
So the worst thing you could put in your mouth, believe it or not, is something like potato chips. It's the number one cavity-causing food. Why?
Tell me why.
It gets stuck in between your teeth. And what's a potato chip? It's a potato, and what's a potato? A carbohydrate. Carbohydrate feeds the bacteria that cause cavities. So foods like that are the number one cavity-causing food. So,
worse than dried fruit.
You may not think about, but those foods, you were spot on when you said drinks, because if you're a big soda drinker and things like that, you're introducing a lot of sugar into your diet. That's absolutely something that's going to increase cavities. But also if you're in a situation where you're, sticky foods like those dried fruits, same thing. They're carbohydrates. They sit in your teeth, and great, eat them. I'm not even telling you not to have candy or chocolate or things that you need occasionally if you want to treat yourself. Obviously, everything in moderation. But go brush your teeth afterwards. Get it out from in between your teeth, and don't let it sit there for, hours and hours and hours and hours eating away. Think of it like termites. We just started termite season here in Florida a week ago in the middle of this pandemic. Believe it or not, people are dealing with termites in their houses depending on where they're at. Think of your teeth when you get foods in there like termites. Termites are eating away at your teeth.
All right.
That's the plaque and everything eating away at your teeth, and the bacteria eating away at your teeth, causing soft spots and causing cavities.
Yeah, it's interesting because we're so hardwired for sugar, but our teeth aren't. Our brain is, but our teeth aren't, and we created a culture where it's almost impossible not to avoid that interaction. All foods do. Ketchup has that in it, probably. But you're right. You're right. The sticky stuff, the cookies too, probably, right? You think cookies would be?
Obviously, if you learn to read the labels, then you see that what's in those foods, and you'd be surprised that the sugar and the carbohydrates and things like that are in these foods. And when you see what's in these foods, and you know that there's, you don't have to be a rocket scientist to know what sticks in between your teeth. You know that.
Right.
Obviously, the foods that don't stick in between your teeth are much, much better. The things that are low in carbohydrates. But at the end of the day, the saving grace is you have the ability with good oral hygiene to make up for the consumption of those foods that may not be the best for your teeth. You can make it up with good oral hygiene. If you go have, some potato chips, okay, you love potato chips and you have to have potato chips once a day and whatever other nutritional negatives they present to you. But as far as your teeth are concerned, if you go brush your teeth after you eat your potato chips, the damage is going to be minimal. And if you don't have food stuck between your teeth, if you don't have open contacts and things like that you're not addressing, then the damage is going to be minimal.
Are there best foods for the teeth?
Yeah, I think your vitamin-enriched foods are great. Things that are high in calcium and things like that are good for your teeth. They help harden your enamel. So I think things of that nature, if you eat a good balanced diet, high nutritional diet, but just things that are high in calcium are the best things for your teeth.
And then what do you think about fluoride?
I think fluoride's great.
Yeah.
I know there's some naturalists that there's been some studies and things, and I don't know your own personal feeling on it. I know the things that you present on your show, but one of the things that I'm always a big advocate on, whenever you hear, negatives on things, always check those sources. Mm-hmm. I know there's people that are very, very negative, and there's studies that have shown, but always check the sources. I don't think you're going to see from major universities and bona fide universities anything that backs up that fluoride doesn't cause a reduction in cavities, makes your teeth stronger. There are many, many positive effects of fluoride, and I know there's, has some controversy out there. But I think at the same time that if you check those sources, the problem what we don't do in our society is we hear something, and especially with the Internet today, we hear something and we consider it to be fact. And guess what I saw on television? Guess what I heard on the Internet? And today, obviously, with what's going on with coronavirus, look what we hear one day.
Right.
The next day is totally disputed and thrown out. There's a great cure, potential cure, and next thing you know, more people are dying from the cure, and it's not working. Or don't wear masks. Now we have to all wear masks. So what we hear today, always check out the sources. And that's our problem is we don't check out. We don't ask the second question, the third question. Oh, fluoride's, terrible. It's bad for your health. You can die. It's linked to cancer. Okay, who said that exactly? And what are their studies? And just because their first name is doctor, please, please, please don't get fooled by that. And even if they happen to be in the right field, check where the source of that study is. See if it's a major university. See if it's a known institute. See if it's National Institute of Health or CDC or, Harvard University or Emory University or great universities. See the sources of those studies. And I think you'd be very surprised when you check out those sources that those studies that show fluoride isn't good for you, they're not very credible sources.
Hey, are you going to, you see patients, right? You're not just an author. You see patients?
No. I'm a wet finger dentist that's dying to go back to work and start seeing patients.
So are you going to be concerned about the virus when you're working on people's mouths?
Every single dentist, dental hygienist, dental assistant is concerned about the virus because we work in two things we have working against us. Number one is the close proximity. Right. And number two is we create aerosols when we're drilling with our air spray and our water spray. And that, there's a lot of controversy about the aerosols right now. So am I concerned? The answer is yes. Am I going to do my job? The answer is yes. Am I going to be smart about how I do my job? The answer is yes. So everybody's concerned, and we're waiting to hear, we can't get PPE right now, personal protective equipment, because we're not deemed essential yet because we're theoretically closed right now, which we are.
Hey, Doc, we're out of time, buddy. I'm sorry. Dr. Rick Mars, dentalcaregroup.net, dentalcaregroup.net. I am Pharmacist Ben. Thanks for listening to The Bright Side. Have a wonderful, beautiful, awesome, spectacular day. We'll talk to y'all later, folks. Bye for now.